Good evening, and welcome to Moving from Healthcare to Self-Care. Before I begin, I want to introduce myself and explain how this program developed. I'm Dr. Small. I practice family medicine in Chesaning for over 25 years. In addition to my medical degree, I received a bachelor's degree in psychology, a master's degree through Liberty Theological Seminary, and a master's degree through Michigan State University. All that said to tell you that I'm passionate about holistic medicine, body, mind, and spirit, and health education. I confess my life probably seems boring to most people. I don't hang out in the doctor's lounge. I don't hunt, fish, or golf. What I like to do, what I think about all the time are life-changing moments. I love to transform lives. That's my job. That's my passion. And that's what this program is about. Today's 2-hour program moves quickly through 5 sections. First, we'll look at surviving the healthcare crisis. The aging population, many with multiple medical conditions, healthcare provider shortages, and a lack of system to the healthcare system. Over the years, I've learned there are 4 major topics that need our attention the most: mental health, overcoming pain, disease prevention, and healthy aging. Tonight, we'll briefly move through each one of these topics, but all the information is covered in depth in my book, Healing the Heart, now available to each of you. Let's quickly examine the developing healthcare crisis. As a society, we've become increasingly dependent on the failing healthcare system. And as our population ages, this dependence will increase. So let's look at the struggles many have encountered: difficulty getting a physician, trouble getting a timely appointment, automated phone systems, difficulty getting medication refills, outrageous costs, an increasing insurance company involvement, and emphasis on treatment rather than prevention. All these are very real issues, and my concerns about the problems that are going to confront us are not exaggerated. My goal today is to reduce your dependence on the troubled healthcare system by lifestyle transformation. However, we can all agree lifestyle transformation is not going to occur just with a pill or even a diet. Substantial, lasting lifestyle changes require a complete, holistic, bio-psycho-social, and spiritual approach. Biological, psychological, social, and spiritual approach. You know, chronic disease accounts for 3 out of every $4 spent on health care, and it's totally preventable. This program is not about managing chronic medical conditions. This program is about disease prevention and reversal. So let's look at just the expected disability here in Michigan, comparing 2012 to 2030. Look at how diabetes, heart disease, and stroke will increase. What about arthritis? Hip replacements are expected to increase 174% and knee replacements by 673% by 2030. The important point is diabetes, heart disease, stroke, and most types of arthritis, which lead to these joint replacements, are diseases of lifestyle, which is something you can control. The problem is our healthcare system in the United States is reactive, not proactive. Doctors only diagnose and treat disease, whereas disease prevention has moved to public health, but their programs are often about disease management and not prevention and reversal. There is a disaster awaiting those who are dependent on the medical system. You have one thing in the year 2030, and that is your health. With it, you will survive. Without it, you will drown. My goal tonight and with my book is to reduce your dependence. So how are we going to do this? We have 3 overarching goals. First, understand the healthcare system. Next, present ways to reduce your dependence on the system. And finally, we'll look at improved health by understanding self. Understanding the healthcare system is important because understanding it will protect you and your family. Regardless of who you are in the system, patient or healthcare provider, or where you are in the system, often the visits, workups, and treatment are unnecessary and often driven by fear. Let's look at how fear motivates the four major players. Patients are afraid of a disease, disability, and death. How many know fear is sometimes contagious? Healthcare providers pick up on your fears and sometimes order unnecessary tests or medications, but also they're dealing with their own fears, making mistakes, insurance company reviews, legal issues, and ever-increasing regulation. What are the hospitals afraid of? Hospitals are often the biggest employers in the community and need to keep the doors open. All the while, the hospital's greatest fear is Medicare surveys and losing Medicare accreditation and payments. Finally, the diagnostic departments have similar fears. Radiologists read all the x-rays, mammograms, CAT scans, and MRIs, and have usually never met the patient, and fear making mistakes and legal implications. So we see this diagnostic propagation going on where one test leads to another. So how can understanding all this protect you? The cycle of fear can only be broken by the individual, by you. And that's why healthcare literacy is so important. I'm going to teach you how to overcome fear by understanding. Many have seen the movie Hunger Games and the dictatorial President Snow, who said, "The only thing stronger than fear is hope." My goal tonight is to increase your understanding, hope, and ultimately your health. Moving on to our second goal. Once we understand the system and the struggles, how do we reduce our dependence on it? First, we'll review important difference between treatment and prevention. Second, we'll look at your ability to change. And finally, see how this program in my book can empower you to improve your lifestyle and reduce your dependence. Let's look at the important difference between treatment and prevention. Treatment is sick care, which is very different from prevention, which is true health care, caring for your health. Many of you know modern medicine has its roots in Hippocrates and Galen, and predominantly about treatment rather than prevention, and always economically based. However, at the same time disease treatment was going on in Greece and Rome, there were people in another part of the world who were learning to prevent disease. The Jewish people, for instance, had rules we can find in the ancient biblical records for prevention, rules to prevent the spread of infection even before they understood the germ theory, rules to prevent heart disease even before they understood cholesterol. And it costs nothing. Treatment is reactive, but prevention is proactive. Treatment is always costly, but prevention is cost effective. Treatment is sometimes painful, but prevention is usually not painful. Prevention is based on a culture of compassion, but medicine was often a culture of silence. In fact, our healthcare system today is playing a role in maintaining poor health as people unconsciously believe they can maintain their poor lifestyles as long as they comply with their medications. Now, I'm not suggesting all treatment is bad, but things like injury can be controlled with safety and good judgment. Infectious disease sometimes needs antibiotics, but there are natural ways to boost your immunity. Pain can sometimes be controlled naturally by increasing endorphins, your natural painkillers, and learning to untangle pain. All topics we'll investigate tonight. Currently, our healthcare system spends $1.20 per person per year on prevention, but $1,300 per person per year on treatment. My friends, the course our current healthcare system is taking is not the correct course. Certainly not the future overall humanity needs to be taking when it comes to your life and the life of your family. However, disease prevention and reversal requires an ability to change. Sociologist Benjamin Barber said, "I don't divide the world into the weak and strong or the successes and failures. I divide the world into learners and non-learners." And that's what we're doing today. We're in a process of learning. Psychologist Carol Dweck studied the differences between those with a growth mindset and those with a fixed mindset. Those with a fixed mindset believe intelligence ability, personality, and competence are inborn and unchangeable. Those with a growth mindset believe, although people may have differences in basic aptitudes, everyone can change and improve. Those with a fixed mindset believe you must be smart. You can't get smart, and therefore they give up too easy. Those with a growth mindset believe, although I may not feel smart, I'm interested in getting smart. Those with a fixed mindset tend to have more anxiety and depression, and those with the growth mindset tend to be more positive and trust others. Researchers looked at children, and those with a fixed mindset chose puzzles which were easier, and those with a growth mindset chose harder puzzles. When we're approaching something so overwhelming as a major change in lifestyle, going from a depressed, anxious person to someone with a sense of security and well-being, from someone living in chronic pain to someone more functional and free from disability, from someone struggling with weight and sedentary lifestyle to a lean body mass and activity, ready to take on the effects of aging, requires perspective transformation. Adult educators tell us perspective transformation is essential for change. Your perspective of life needs to be transformed before you can be transformed. Unfortunately, some people's perspective only changes after a disorienting dilemma. Disorienting dilemmas are major life changes, such as loss of a job or major health change, that force us to change the way we view life. Disorienting dilemmas, as we've all experienced, do result in perspective transformation. However, we can have perspective transformation without the disorienting dilemmas if we're properly educated, if we explore new self-concepts, who we are, and try on new roles. Our third goal. Real life changes which promote health and well-being requires a holistic approach, body, mind, and spirit, and understanding our complete human nature. Improved health by understanding all aspects of self. As a society, we're beginning to understand the need for such a holistic approach. Improved health by understanding self. You know, there's been a lot of research and money spent to learn what motivates people to prevent heart disease. So the American Heart Association looked at 70 different studies on disease prevention. And among their conclusions, let's read it, cognitive behavior strategies are an essential component of behavior change intervention. These strategies focus on changing how an individual thinks about themselves, their behaviors and surrounding circumstances, and how to modify their lifestyles. This is improved health by understanding self, changing how an individual thinks about themselves. They're suggesting you can improve your overall health and well-being by using cognitive behavior strategies, learning to structure your thinking, controlling health by controlling the types of thoughts that you have. We're about to set the stage for a way of thinking that controls mental health and reduces chronic pain, a way of thinking which promotes disease prevention, allowing us to age gracefully, all by learning to structure and take control of your thinking. The American Heart Association, looking at 70 studies on disease prevention, discovered the importance of understanding who you are. As you come to understand who you are as a person, your thinking changes, your actions change, and you're able to overcome all these struggles in life, all by understanding who you are. Improved health by understanding self. So let's look at the words used to describe self, who we are, our complete nature. As I studied psychology, I became interested in words like mind, thoughts, emotion, and imagination. I went into medicine and became interested in the brain, the cerebral cortex, and in particular that prefrontal cortex used for higher thinking, and the limbic system for emotions. Naturally, as I entered seminary training, I became interested in other words which describe human nature, like soul, spirit, and the metaphorical heart. What I learned was many of these words are referring to the same thing. They all had different names, but all refer to the same process. For instance, psychologists talk about thoughts. whereas medical science looked at the brain physiology, giving rise to those higher levels of cognition and thinking. Health educators referred to metacognition, meta meaning beyond, and cognition thinking. So metacognition is beyond thinking, setting back and reflecting on your thoughts. That's education. Throughout seminary training, I learned ancient writers didn't understand the prefrontal cortex. They thought the brain was simply the bone marrow of the skull. Rather, they used words like soul and spirit and the metaphorical heart. Interesting, for many ancient writers, spirit often meant simply a higher level of thinking, metacognition. Now, just because ancient writers didn't understand the brain didn't mean they were stupid. There's something we can learn from ancient writings, but too often people hear the word spirit and get turned off, assuming I'm referring to some religious concept. Let's look at the medical definition of spirituality. This is the national consensus-derived definition of spirituality. Spirituality is an essential element of humanity. It encompasses individual search for meaning and purpose, what's going on and what we should be doing. It includes connectedness to others, self, nature, and the significant or the sacred. This definition is very broad, embracing religious and secular beliefs, as well as philosophical and individual cultural practices. However, the word spirit can be used in a very scientific way. What would you name the structure you sit on when you look back upon yourself and analyze your existence? The word spirit is a proper name for that structure. This is how self-awareness occurs. And understanding self-awareness is very important as it allows you to develop self-control and self-motivation, things essential to improving your health. So a very simplified way of thinking about spirit would be like taking a selfie. Your spirit allows you to take a selfie of your complete nature and then stand back and examine it. Your spirit is the eye peering into the soul. Those who study child development call this higher level of thinking formal operations, which starts to happen in our teen years when we're capable of thinking about things we cannot see. When we start to deduce and reason, something spiritual happens. Our higher thoughts take on a life of their own. Something new develops when your thinking reaches formal operations, which does not occur dwelling on the things of the world or only on ourselves. So spirit is the structure or scaffolding which gives self-awareness, self-consciousness, and allows you to have self-control and become self-motivating. But we must learn to develop this thought life. So let's look at how this applies to the four major areas we'll look at tonight. First, mental health. How many know that a pill is not the answer for every mental distress? But how many know that your thinking is sometimes important for mental health? But how many of you know that sometimes it's difficult to remain positive in a chaotic world? Thinking about your thinking is important, but the problem is mental illness can rob you of your ability to think your way out of it. So it's a two-way street. Here's the important thing. The resulting lifestyle issues then lead to decreased frontal lobe function and depression. So the person is left trapped in this vicious triangle. This is where developing spirit, developing a higher level of thinking can help you think your way out of mental problems and into a healthy lifestyle. We see the same thing happening as we discuss chronic pain. Once again, people become trapped in a vicious cycle, stuck in the middle of a triangle, trapped in chronic pain, anxiety and depression, and often taking medications which are no longer helping and often making things worse. Pain has three components: the painful sensory experience, next your emotional response to the pain, and finally your cognitive evaluation, your thoughts concerning the cause and significance of the pain. Spirituality helps you to untangle these components. You'll see a physical metabolic trap called Syndrome X or metabolic syndrome. Here again, thinking about your thinking, metacognition, spirit, whatever term you want to use, is essential to getting yourself out of this metabolic syndrome. Finally, we'll look at aging, where preserving memory and cognitive abilities becomes extremely important. Interestingly, depression and uncontrolled pain has a negative impact on physical brain function, but proper diet and exercise protects brain function. So all this comes together in the last section on graceful aging, where the quality of your thinking, your diet and exercise, lifestyle, even influences your genes, your heredity. The quality of your thinking can even control the expression of some of your genes and slow the aging process. The quality of your thinking can even control the expression of some of your genes and slow the aging process. This is not going to be just another self-help program. People who stick with this will make some real life changes, a transformation. But it's going to happen because I'll take a holistic approach using body, mind, and spirit, but also developing your heart and morality. To help us with these spiritual issues, I'll be using the tools of Christianity. I'm not going to preach, but I'll be reviewing scholarly articles and some cutting-edge medical thinking. But the teachings of Jesus promote the development of higher thinking and spirit to such a level it actually takes on a life of its own. A new life. So dramatic to transformation, Jesus called it being born again. He showed us we can take on the motivating morality without the guilt of failure because he taught us and showed us the concept of forgiveness. Also, the security of his teachings releases us from fear, which we saw motivates the flawed healthcare system. Jesus' teachings release us from fear. My friends, these are dangerous times we're living in, and something needs to be done to protect yourself and your family. But it begins with a decision. Can you decide today to take a growth rather than a fixed mindset? Can you decide today to take a journey that results in perspective transformation that will make you and maybe your family and friends healthier? With these tools, you'll be able to overcome the greatest obstacles in healthcare and survive the healthcare crisis. So let's get right into understanding mental health. We're going to look at the overall topic of mental health. However, because depression is so common, the third most common reason people go to a doctor, we're going to use depression as a case study. Mental health is so important because studies have shown inadequately treated depression can lead to permanent structural brain changes. On the other hand, optimism is a significant predictor of positive physical health outcomes. Improving depression reduces pain. This is huge because depression and pain are linked in the brain, and it's a two-way street. Pain can lead to depression, but depression can also lead to and aggravate pain. A study in 2011 suggested a depressed mood may be linked even to rheumatoid arthritis disease activity. Researchers showed depression was not just the result of the pain, but high depression scores accurately predicted arthritis flare-ups 6 months later. Depression affects your overall health. It increases your risk of coronary artery disease, blockages of heart arteries that cause heart attacks. There's also a strong association between depression and stroke. In fact, the depression-stroke association was just as strong as the smoking stroke or obesity stroke associations. Depression, anxiety, pessimism causes the body to think something is wrong, and therefore the body's going to prepare for battle. So these inflammatory chemicals increase, which cause these plaques to rupture. Then clots form, blocking flow, leading to the heart attack or a stroke. So what you think about has a powerful effect on your body. Moving from healthcare to self-care and surviving the healthcare crisis is about learning to control your thinking and dealing with stress in healthful ways. Let's look at the causes of depression. First, the biological causes, then the psychological and social causes, and finally digging into those spiritual roots of depression. I break the biological causes of depression into hormonal, things like thyroid disorders, vitamin D deficiency, premenstrual and postpartum depression, then brain disorders, post-stroke or vascular depression, and brain chemical imbalances. Importantly, metabolic syndrome causes depression. Metabolic syndrome is the overall body condition associated with diabetes, heart disease, blood pressure, and cholesterol, and obesity. So this overall syndrome can cause brain changes leading to depression. Also, frontal lobe dysfunction can result in mental illness. Let's take a closer look at frontal lobe dysfunction and depression. This is a picture of two psychiatrists from the University of Michigan and their transcranial magnetic therapy stimulation chair. Here you can see the treatment coil, the prefrontal cortex of the brain, the stimulated area, and the magnetic field. Basically, they're introducing a magnetic field through the skull to stimulate or depress various portions of the frontal lobe of the brain. The brain is divided up into 4 lobes, and the frontal lobe, and particularly that prefrontal area, is the part of the brain that makes us most human. It's the control center of the brain, involved in behavior planning, decision-making, emotional control, self-awareness, but also morality and spirituality. When this prefrontal area is not functioning correctly, we experience impairment of moral principles. Social impairment, lack of foresight, problems with abstract reasoning, loss of empathy, and lack of restraint. We suffer from uncontrolled emotions, all the problems associated with mental illness. This is Phineas Gage. You can see he only has one eye, and he's showing you the rod that went through his head. He taught us what it's like to live without the left prefrontal lobe of the brain. On September 13th, 1848, he was working in railroad construction and blasting through rock when this tamping iron rocketed through his face and out the top of his head, and he lived 14 more years. His physician, Dr. John Harrow, wrote his medical report in 1868. The equilibrium or balance between his intellectual facilities and animal propensities seemed to have been destroyed. He is fitful, irreverent, indulging at times in the grossest profanity, which was not previously his custom, manifesting but little difference for his fellows, impatient of restraint or advice when it conflicts with his own desires. In this regard, his mind was radically changed, so decidedly that his friends and acquaintances said he was no longer Gage. So we learn from Gage, the frontal lobe of the brain has to do with our personality, our self-restraint, our moral standards, and our ability to commit to family, church, and our loved ones. All problems associated with mental illness. Dr. Neil Nedley, in his book, Depression, The Way Out, which I would highly recommend, shows how frontal lobe dysfunction causes depression. And all of this, depression and frontal lobe dysfunction, is influenced by our lifestyle. The brain's frontal lobe gives us the ability to identify and implement strategies to help alleviate depression. This is very important. The prefrontal cortex gives you the ability to identify and implement strategies to alleviate depression. So, decreased frontal lobe ability can cause depression, and depression then further decreases the frontal lobe's ability to get out and alleviate the depression. This vicious cycle impairs our natural ability to overcome the depression. An analogy would be the disease of AIDS. The AIDS virus attacks the actual immune cells responsible for fighting that AIDS virus. So depression attacks your mental immunity, your immunity against depression, and it does this by decreasing frontal lobe abilities. Now, you can understand how bad lifestyle choices such as poor diet, lack of exercise can lead to heart disease, cancer, stroke. But an even more serious problem is how these same bad lifestyle choices can lead to decreased brain frontal lobe function. So yet another vicious cycle develops. The decreased frontal lobe abilities with the loss of behavior planning, loss of proper decision making, loss of self-awareness and self-control then leads to numerous lifestyle problems and ultimately to multiple chronic diseases. These multiple chronic conditions then lead to further decreased brain frontal lobe dysfunction. Finally, the person is left trapped in this triangle of a harmful lifestyle, leading to decreased frontal lobe function and depression, which causes the harmful lifestyle to worsen. They're trapped in this dungeon. They're trapped in this dungeon of depression, and many people never find their way out. So those are some of the physical causes of depression: hormonal, various brain disorders. Now we're going to quickly move through some of the psychological and social problems which can lead to depression. Many social problems present with depression because relationships are so important, and when not running smoothly can be such a big source of distress. I place substance abuse in this category as it frequently starts and is perpetuated in social circles. Introducing foreign substances into the brain can result in this chemical imbalance type of depression, which is very difficult to treat with antidepressants alone. Marijuana is very destabilizing to the brain and very depressivogenic, or depression beginning. Unemployment, both imposed and self-inflicted, can result in depression and needs to be addressed, as people were made to work, and without it, we often feel incomplete. These are just a few of the psychological conditions associated with depression: obsessive compulsive disorder, bipolar disorder, once called manic depression. Also in this psychological category are anxiety disorders, panic attacks, and seasonal affective disorder, which can all have associated symptoms of depression. So we've looked at the biological, social, and psychological causes of depression. Now let's turn our attention to the spiritual causes. She had endured much at the hands of many physicians and had spent all she had and was not helped at all, but rather had grown worse. This Bible verse in Mark 5:26 is not in reference directly to mental illness, but could be, because many have received numerous treatments and have only grown worse. Mental illness is a devastating problem and can be difficult to treat, and therefore must be understood and managed holistically: body, mind, and spirit. Now you'll recall those who study child development call this higher level of thinking formal operations, which starts to develop in our teen years when we're capable of thinking about things we cannot see. Now, along with this stage of formal operation comes certain cognitive needs, certain thinking needs, which are not met just dwelling on the things of the world or yourself. Failing to acknowledge and attend to spiritual development contributes to a sense of aimlessness, resulting in feeling overwhelmed, helpless, and hopeless. Something new develops when your thinking reaches formal operations, which doesn't occur dwelling on the things of the world or yourself. And here's the important point: thoughts centered only on the things of the world or ourselves often end up degrading down to depressive thoughts. Embracing spirituality helps us to take every thought, emotion, and motivation captive. Spirituality enhances prefrontal lobe function. Spiritual development is the scaffolding we climb on to look back and reflect on our lives. Spirituality allows us to understand and control and change thoughts, moods, and motivation. Spirituality enables and inspires us to change. Now we're going to move from the causes of depression to the treatments, beginning with biological treatments, then psychological treatments for depression, such as counseling, and then on to spiritual treatments for mental illness. Again, we'll be concentrating on depression because it's so common, but the principles apply to other mental disorders as well. Before we evaluate specific treatments for mental illness, we must look at your overall lifestyle. Is your lifestyle conducive to healing? Is it fertile ground? How effective is dropping a Prozac seed into the garden of your mind if it's full of weeds and thorns? It's almost impossible to treat depression without adequate exercise. Proper diet is essential to your well-being. Numerous studies have shown lower incidence of depression and anxiety in vegetarians compared to non-vegetarians. You need adequate rest, relaxation, sleep. Appropriate social interactions are invaluable. Many people with mental illness tend to isolate themselves, which only makes things worse. We all need a sense of belonging and family. And I can't emphasize enough, just getting outside. It's hard to see God inside man-made structures. Are you drinking enough water? Or is your brain shrunken from chronic dehydration? What are your stress reduction techniques? Do you have any spiritual disciplines? What are you filling your life with? What are you filling your brain with? Are you watching horror movies or sad, depressing programs? What about obsessing on news programs? Of course, we need to avoid drugs and toxins, even caffeine, but especially alcohol and tobacco. Smoking 1 pack or more a day results in a 3-fold increase in major depression. It's hard to treat mental illness with specific therapies if your overall lifestyle is not conducive to healing. Light therapy may be helpful. Vitamin D is essential for treatment of depression. Medications such as antidepressants can be very helpful. Getting the right drug to the right person can sometimes be life-changing. But one thing they've proven about medications, they won't help you if you don't take them. Compliance is essential. Let's compare all these physical methods of treating mental illness to something like counseling, the talking cure. Medications, supplements, light therapy, or even transcranial magnetic stimulation could be considered reductionist therapies. People who rely solely on these therapies believe depressive thoughts and feelings result from an abnormal brain. They reduce thoughts to the brain level and then try to fix the brain. However, other therapies are considered metacognitive. Meta meaning beyond and cognitive meaning thinking. So thinking about your thinking is metacognitive and the basis of psychotherapies, cognitive therapy, self-help education, and spiritual therapies. Not all depression is biological, and therefore psychologists are experienced in a variety of counseling methods. Cognitive behavior therapy is very effective for depression and shown to be just as effective as medications for panic disorder. Cognitive therapy is simply thinking about your thinking. Patients learn to identify emotions and automatic thoughts, including ingrained, unproductive ways we deal with life. For example, if I lose something, I automatically assume someone stole it, and that's never the case. I learned this bias, and by identifying it, I can unlearn it. So when I can't find something and automatically assume someone stole it, I can step back and tell myself, no one stole it, Roy. It's probably misplaced. The point is there are a lot of things in our lives like this, and we can learn to identify them. So cognitive therapy teaches us to think about thinking. What the Bible says is learning to take every thought captive. It's based on an information processing model. The way an individual structures their thoughts and experiences determines how they feel and behave. Too often, though, our thinking lacks structure, so we can't control it. People tell me all the time, I can't turn off my brain at night. One thought leads to another. I hear this all the time. That's the problem with this thinking spiritual world. It lacks structure, so people tend to ignore it, and therein lies the problem. To simplify things and learn to structure our thinking, psychologists developed the ideas of schemas. Now, schemas are broad mental categories, almost like storage bins we can put things in. Schemas develop automatically over our lives and help us to make sense of everything. Schemas are enduring cognitive structures, thinking themes which develop and can influence subsequent concept formations. They grow and develop. Now, schemas are involved in reality testing. So if your life theme is abnormal, you can lose the ability to view things objectively and even start believing lies, which is the scariest place of all. And it's not just people with mental disorders who've learned abnormal ways of processing or structuring thoughts and information. We all do this to some extent. A depressed person, or maybe somebody who's just struggling with a bad mood all the time, at some point must get control of their thinking. Cognitive therapy, helping us think about our thinking, leads us to a plane higher than ourselves. Therefore, could be considered a form of spiritual therapy. Just as we can hire professional organizers to put our possessions into storage containers, Over the centuries, people have tried to develop pre-programmed ways to structure thinking. Worldviews are pre-packaged schemata. Worldviews give us preset patterns to organize our thoughts so we can live life and not constantly worrying about analyzing it, suffering the paralysis of analysis. So reductionists suggest a pill can change our brain chemistry, which changes our thinking to achieve mental health. Conversely, the metacognitive view suggests the things you think about can change your physical brain, and along with that, your life and health. This National Geographic magazine shows a Tibetan monk meditating with numerous EEG leads on his head. And EEG shows how things you think about, your state of mind, can change the electrical activity of the brain. Thought is changing brain. This is like the software changing the hardware. It doesn't happen in computers, but it does in your brain. Neuropsychiatrist John Ratey suggests the brain is malleable and transforms itself according to what we learn, think, and experience. Experiences, thoughts, and actions and emotions actually change the structure of our brains. Now, the bigger and most important question: what kind of thinking, what kind of schemata, what kind of pre-packaged worldview, what kind of spiritual program has the best effect on your brain, on your life, and consequently on your health? We can't all move up on a mountain in Tibet and meditate all day. And some people consider themselves agnostic, suggesting they don't have enough information to make a valid overall worldview about what's going on and what it's all about. However, over the centuries, some people thought they did have enough information. They were the founders of major thinking programs we call major world religions. Men like Buddha, Muhammad, and Jesus. Now, I've shown how important it is to understand who you are. I've shown what you think about can actually reshape your brain. What then is the best thinking? What is the best thinking program or worldview to improve your life and health? Jesus designed a spiritual software program to get the most out of this thinking machine we call our brain. Jesus lived in a very unique time, blending Greek philosophy and teaching with Jewish religion. He presented us a way to structure thinking for mental health and spiritual well-being, which ultimately leads to physical health. The teachings of Jesus have persisted over time as they were revolutionary and healing. In fact, the word Jesus used for salvation is sozo, which is translated also into our word heal or be whole. The salvation Jesus brings is not only everlasting life, but also includes health, mentally, physically, and spiritually. Jesus understood the plight of those trapped in the vicious triangle of harmful lifestyles, decreased frontal lobe function, and depression. Many people are trapped in the kingdoms of this world, in the dungeons of this world, or within themselves. Sadly, many never find their way out. Patients with depression are trapped inside thinking patterns which are restricted, closed, and unyielding. Trapped inside the dungeons rather than living in the kingdom of God. To help structure the kingdom of God in our lives, we need to develop spiritual disciplines like Bible reading and memorization, prayer, and church community. Having the Word of God going through your brain every day is healing. We're going to take a 10-minute break and resume to discuss ways to overcome pain, disease prevention, and graceful aging. We spent more time on this because reducing your dependence on the healthcare system and surviving the healthcare crisis requires mental health. Getting control of pain and preventing disease with proper diet and exercise requires mental health. Graceful aging requires mental health. I'll see you back in 10 minutes. Maintaining good health requires disease prevention, which is almost impossible if you're suffering from depression and chronic pain. As we reduce our dependence on the healthcare system, we need to be very careful about medications which cause dependence, both physical and psychological dependence, but also dependence on the healthcare providers prescribing these medications. Pills are enslaving people to the healthcare system, but also killing people. Our country is eating up 80% of the world's supply of these types of opioid medications. Why? No one likes to be in pain. Let's take a moment and look at the experience of pain through the eyes of Emily Dickinson. Pain has an element of blank. It cannot recollect when it began, or if there were a day it was not present. Pain has no future but itself. Its infinite realms contain its past, enlightened only to perceive new periods of pain. Emily suggests when we're in pain, we can only see pain and nothing else. Pain consumes us. Pain changes us. And let's see how pain changes us mentally, but also physically and spiritually. Civil War physician Dr. Weir Mitchell describes how pain changes us mentally. Under such torments, the temper changes. The amiable grows irritable. The bravest soldier becomes a coward. Research shows pain can actually change your physical brain. Recent studies show how chronic pain is associated with cognitive impairment and decreases in cortical gray matter. Chronic pain thins out your brain. But the studies show successful treatment to alleviate, for example, chronic back pain, restored normal brain function. Therefore, pain treatment should begin early and as aggressively as possible. But that does not necessarily mean taking Vicodin or Norco or any pill for that matter. So, pain can change us physically and mentally. John Milton in Paradise Lost explains how pain can change us spiritually. Pain is perfect misery, the worst of evils, and excessive overturns all patience. Pain calls our spiritual beliefs into question, even reality itself. Indeed, pain distorts reality, and pain is the reason many deny the reality of God. Let's look at pain pathways and see how they can be influenced naturally without medications. If you happen to poke your finger, the painful impulse moves from your finger to the spine and finally up to the brain where you become aware of it. I was 9 years old when I had my first real experience with pain. For 2 days and at least one night, I spent agonizing in severe nonstop earache. Toward the evening of the second night, Grandma cut up an opioid painkiller called Percocet into a quarter tablet and gave it to me. After a short time, that constant throbbing pain I'd experienced for 2 days started to die down. But not only that, I was left with this wonderful sense of well-being and security as I could finally lie down to rest. Now I can look back on this experience and understand from a physiological standpoint exactly what happened. Opioid painkillers do two separate things in the brain. First, they block the pain you feel. Opioids block the nerve impulse to the sensory part of the brain, but also they reduce your emotional response to the pain. In fact, giving us a sense of well-being while we endure the condition. This cutaway picture of the brain shows those two pathways. The pathway on the upper right to the sensory brain, and the pathway on the left to the part of the brain called the limbic system. This second pain-relieving pathway, leading to the emotional part of the brain, what I call the blessed second pain pathway, can result in a sense of euphoria, a warm sense of security and well-being. So pain has both a sensory component, what you feel, and an emotional component, your experience of it, which can result in suffering. There's a real difference between feeling pain and suffering. Pain is inevitable, but suffering is optional. But why do we have this second blessed pain-relieving pathway? Simply put, God understands the interaction between pain's physical and emotional components. In fact, it's very difficult for us to separate out physical and emotional pain, as both pathways are close to each other in the brain and have a lot of overlap. Those are the two opioid pathways, but we have many ways to modulate pain and reduce suffering. Pain modulation occurs in other brain areas and in the spine. One important brain area is that prefrontal cortex. You'll recall this area. This area controls executive functions. Thought processes regulate, control, and manage other thought processes, but also controls and regulates emotion, imagination, and pain. This is important to understand because emotion, imagination, and pain get entangled in the brain. And so that prefrontal cortex comes to the rescue, allowing us to untangle the pain, untangle the sensation of the pain from our emotional response and imagination. Allow me to share another example, or an example of untangling pain. A long time ago in a faraway place, I needed a cap put on a tooth. The dentist numbed my mouth and stepped out for a moment. The receptionist came in and told me the procedure would cost $1,000. I had already exhausted the insurance benefits. Well, I was already numbed and went on with the procedure. 2 days later, the tooth was hurting even worse, and I needed a root canal, which set me back another $1,000. As I drove home from the endodontist, I was still in pain and upset with the original dentist for not being upfront about the cost. Only to make things worse, I started imagining the tooth may need to be pulled. All the while, ibuprofen was upsetting my stomach and not lasting the full 8 hours. I was not only in pain, but also suffering as my imaginations and emotions were entangled with the pain, therefore making things worse. I couldn't sleep that night after the root canal, so I got up and wrote everything down. I untangled the suffering. I discovered my sensation of pain was entangled in emotion and imagination. I had the toothache, but also upset with the original dentist, the emotion of anger, all entangled in imagination, fearing I may need the tooth pulled, which I never did. Now, understanding the predicament, I decided to move on, forgive the dentist, and stop pretending I would need the tooth pulled. Finally, having cleared my mind of the excess baggage, I was able to concentrate on the pain itself. Since ibuprofen 800 was upsetting my stomach, I tried 400 milligrams. Therefore, I could take it every 4 hours, which worked great. The untangling process was accomplished using the phenomena we previously reviewed called metacognition. Thinking about your thinking, which occurs in the prefrontal part of the brain, giving us a way to reduce pain naturally. Mental illness and improper use of medications, however, can interfere with our metacognitive abilities. And also, our metacognitive abilities need sharpened and prepared for the task by the honing effect of spiritual disciplines. Things like prayer, Bible reading, and memorization, and church community. Pain can also be treated or blocked in the spinal cord level using medications like gabapentin, Lyrica, and Cymbalta. This slide shows how the antidepressant Cymbalta can affect both spinal pathways and the mental, emotional components of pain. Another pain modulating area is the fight or flight system, which prepares us for emergencies. We've all had the experience of a painful situation we didn't even notice as our adrenaline was high. For example, in an emergency or we're working very hard. This is the autonomic fight or flight nervous system at work. However, this can work against us when this fight or flight system is constantly overstimulated due to stress. A final area of the brain modulating or reducing pain is the cingulate cortex, where your thoughts and emotions merge. The cingulate cortex responds to both physical and emotional pain. Your emotional state unquestionably influences pain. One of the most effective ways to treat pain is to just get to the source of the problem, which is usually at the tissue level. For example, a thorn in the skin can set up the process of inflammation. The most powerful of the anti-inflammatory medications are the anti-inflammatory steroids, like prednisone. Also, we have the non-steroidal anti-inflammatory medications, the so-called NSAIDs, medications like ibuprofen, and in particular, Motrin's brand of ibuprofen, Motrin IB, seems to work the best. Tylenol is not an anti-inflammatory, but it is easier on the body and very often very effective. Knee osteoarthritis provides a great case study for pain because knee osteoarthritis is the most frequent cause of mobility dependency and diminished quality of life. And only half the patients with knee arthritis experience even a 30% reduction in pain with medications alone. Our joints are lined by cartilage, like the fleshy part of your nose or ear. The picture on the right shows how the bone and cartilage can break down in an osteoarthritic knee. However, patients can have pain even after a knee joint replacement. So what's the cause of the pain? Usually the same thing that caused the arthritis in the first place: weak muscles and tight ligaments around the joint. Likewise, studies have shown joint pain after activity is usually from structures around the joint, such as muscles, ligaments, or tendons. Therefore, stretching is extremely important. Also, the buildup of inflammatory chemicals in the body can cause and aggravate many painful conditions. If it were possible for two individuals, one normal weight and one overweight, to have identical injuries, the overweight person would have more pain. The Einstein aging study discovered a correlation between chronic pain and obesity in the elderly. Obese subjects were twice as likely, and severely obese subjects more than 4 times as likely as normal weight subjects to have chronic pain. They found obesity is associated with higher levels of pain-causing chemicals in the body. Joints that stiffen up start to wear wrong with pressure points. So it's important to make sure the joints stay stretched out so they can move freely. Stretching also releases endorphins, or natural painkillers, in the tissues. And let me point out especially how this prayer posture is very effective at preventing arthritis. So we should stretch and lengthen strong muscles and strengthen weak muscles. But how do we get started? How do we increase self-control to diet and exercise to boost our natural painkillers and immunity? How do we increase our self-efficacy to handle painful situations? We need tools. But if the only tool in the shed is a hammer, every problem looks like a nail. If the only tool we have to treat pain is a pill, then the God Almighty pill is the best tool for the job. If the only tools we have are owned by orthopedic surgeons, then surgery is the answer. So we need a variety of pain-relieving tools. I gave you the tool of understanding pain and pain pathways, ways to untangle pain. I showed how the tools of weight control and stretching can be used to prevent and manage a variety of painful situations, including chronic arthritis. There's still another tool. We can increase our pain tolerance. We can increase our self-sufficiency or self-efficacy. Now keep in mind, I'm talking about chronic non-malignant pain, not acute pain like a broken bone or cancer. First, to increase our self-efficacy and pain tolerance, we must get away from the mindset that all pain is evil and must be avoided at all costs. This is a 7-month-old boy seen by orthopedic surgeons March of 2010 with a congenital insensitivity to pain. He was born with an inability to feel pain, presenting with an abscess and dislocated elbow, but he couldn't feel pain. He just wasn't moving the arm. They said he had multiple ulcers over both hands and feet. Pain can be an indicator that something is wrong and even protects us. So pain is not just a bad thing to be prevented at all costs. The other thing we need to avoid is kinesiophobia. Of course, phobias are an irrational fear. Some people have developed an irrational fear of movement, believing if something hurts, don't do it. This fear of movement and health anxiety gets blown out of proportion, catastrophized, and can even lead to worsening pain. It's important to remember that muscles and joints that don't move hurt. Muscles and joints that don't move hurt. Sometimes the best thing to do for a painful joint, muscle, or tendon is to massage, move, and gently stretch it. This not only helps the healing process, but stimulates natural painkillers in tissues. Especially if your endorphins, your natural painkillers, are already built up from exercise. Again, I'm not referring to an acute severe injury like a broken bone. Often, we find the individuals trapped in the middle of yet another vicious cycle. Chronic pain, mental illness, and often taking medications which are no longer helping and often making things worse. Addictionologists often talk about the downward spiral which destroys a life when opioids and nerve medications like Xanax are used together. We reviewed mental health first because 65% of chronic pain patients have at least one psychiatric disorder, and 65% have a major depressive disorder. So, when we board the plane of pain, we must limit the emotional baggage and replace it with the carry-on case of understanding. As much as possible, we do need to keep calm and carry on. This is such a good simile because, as we've seen, Emily Dickinson suggested that when we're in pain, we are really on a different plane of experience. Nothing can disrupt pain. Nothing can disrupt our thinking like pain. And that's why our thinking must take flight above and transcend the experience of pain and even enter the realm of spirit. God thinking, in particular, the type of God thinking Christianity produces, sets in motion a whole series of cognitive events which heal us mentally and physically. Skeptical? Let's quickly put it to the test and investigate how to control pain by applying spiritual concepts. This cognitive coping, as opposed to chemical coping, will give us another tool in our shed. We also saw how the mind can twist the body into pain. Stanford University researcher Albert Bandura showed the profound influence proper thinking can have on the level of your natural painkillers. Again, the larger question becomes, what kind of thinking best improves our self-efficacy? What kind of thinking best improves our natural pain-killing abilities? What kind of thinking best gets us to that higher level or plane to untangle or untwist a chronic painful experience? I've developed 5 traits, characteristics of kingdom walkers. 5 traits of those living in the kingdom of God. 5 ways to increase your self-efficacy, your natural pain tolerance. Understanding, joy, prayer, trust, and hope. First, understanding. Pain can overcome us, and it's easy to get lost in the experience of pain and say, I hate this, life is awful, why would God do something so terrible? Getting mad at God only makes things worse. Remember, pain gets entangled with emotions. Also, Christianity gives us the best worldview to understand suffering. If we have no overall worldview, suffering just seems meaningless, and the meaninglessness only makes the suffering worse. Second, joy is the second way to increase self-efficacy and increase your natural pain-fighting abilities. Kingdom walkers are frequently heard using the word joy, best defined as a state of delight and well-being that comes from knowing and serving God. I love this definition because it emphasizes a sense of well-being. Illicit drug use is man's desperate and relentless search for a sense of well-being and security, which Christians receive naturally as one of the fruits of a spiritual life we call joy. Recall, emotional pain is sometimes misconstrued as physical pain. Joy helps to keep us calm and gives us a sense of security while we endure the suffering. Prayer is the third and most important tool to control pain and suffering. Jesus taught us to use prayer as our primary source of healing and pain relief. Prayer is the most effective platform for self-reflection. And yet, as noted on page 71 and 72 of my book, is the best way to separate from ourselves. The fourth characteristic Jesus taught us is trust. Luke 18:17 says, "Truly I say to you, whoever does not receive the kingdom of God like a child shall not enter it at all." We must not only have trust and faith, we must have childlike trust and faith. We trust our King and know for sure He cares for us. And He understands the pain we endure and has a plan for all of this. Finally, Jesus taught us the importance of hope. We must always apply that healing balm of hope to any painful situation. Romans 8:26 tells us hope is the means through which the Holy Spirit heals us. Healing is uniquely extended as we hope. In this fourth section of tonight's program, we'll look at disease prevention, which further reduces your dependence on our medical system, allowing you to age gracefully and survive the healthcare crisis. Specifically, we're going to talk about continuing process of lifestyle upgrades. Cholesterol, diabetes, and high blood pressure are epidemic in our country. So common the cluster of these conditions, it was named Syndrome X. Ultimately, the underlying cause is too much insulin. Now, this is important to understand because foods which increase insulin are deadly. Thus, the reason I'm presenting this. I want you to understand how to avoid high insulin levels, which lead to high blood pressure, cholesterol, obesity, and contrary to what you may think, high insulin can cause type 2 diabetes. As you know, sugar or glucose turns on insulin production. Insulin is a hormonal key. Insulin is a hormonal key which moves sugar from blood into cells where it belongs. If you have too many insulin keys, the locks wear out, becoming resistant to the effects of the insulin. So the sugar goes up. It's important to understand abdominal fat turns on insulin production, much like eating sugar. There's more blood supply in your gut than anywhere else in your body. So abdominal free fatty acids are constantly delivered into the bloodstream, increasing insulin levels as if you were eating sugar 24 hours a day. Insulin resistance is what causes type 2 adult onset diabetes. If the body is resistant to the effects of the insulin, then blood sugar slowly goes up, resulting in even higher insulin and more resistance, more insulin lock dysfunction. Thus, a vicious cycle develops: too much sugar, too much insulin, insulin resistance, leading back to elevated sugar, and the cycle goes on. Now, with that understood, we can lay the final piece of the puzzle leading to your first heart attack. This high insulin causes blood pressure to increase. This high insulin causes bad LDL cholesterol and triglycerides to go up. This high insulin causes protective LDL cholesterol to go down. And finally, the important take-home message, and the reason we reviewed all this, insulin makes you hungry, further increasing your weight. So an even bigger vicious cycle develops. Too much weight leading to elevated insulin, the insulin making you hungry, and so we eat more, which causes increasing central obesity, and the cycle goes on. And now we understand insulin metabolism. We no longer call it Syndrome X, it's called metabolic syndrome. Therefore, if you're struggling with weight and hungry all the time, you probably have elevated insulin levels, fueling the gears of two vicious cycles leading to poor health. Another trap has developed. We saw a trap in mental health and a trap in chronic pain, and now we've exposed a physical metabolic trap in our bodies. So what's the way out? We spent a lot of time talking about this because understanding insulin resistance allows you to make better food choices. We need to avoid foods that increase insulin production. Also, this explains why it's so hard to start dieting when elevated insulin levels are causing us to feel hungry. However, after a couple of days of proper dieting, your insulin levels will come back down and dieting will become easier. Of course, if you're prescribed insulin and dependent on it for your life, which is a totally different situation, if you've been prescribed insulin, don't stop it unless you're directed by your healthcare provider. So, what can we do to turn down insulin levels? Sometimes very simple changes in diet can make the weight fall off easily. Just remember the principle of avoiding insulin production. The first thing is to eliminate all liquid calories, as they're absorbed very quickly through the stomach into the bloodstream, demanding immediate and high insulin production. Even so-called good drinks such as orange juice and milk are loaded with these bioavailable calories. Sugar-sweetened beverages like pop, tea, but also milk and juice have got to go or you will not lose weight. Also, refined simple sugars such as ice cream, cookies, donuts, candies increase insulin, and they're just wasted calories. As we age, our body requires less and less calories, and thus learning to break the addiction to sugar is so important. Until you get control of your diet, you need to be at ground zero when it comes to sugar. You need to completely unhook from that sugar train that's heading to the doctor's office and the hospital. One of the things I want to emphasize today is the importance of just continually upgrading your lifestyle, specifically upgrading your diet and activity level. We don't have enough time to look at all these diets, and I know everyone is not going to walk out of here and never eat meat again. However, if you don't know where you're supposed to go, you will never get there. At least understand the perfect, healthy diet is a vegan diet. So we move from the typical Western diet and upgrade further to the Mediterranean diet by reducing meat and adding beans, nuts, and fish. The pescatarian diet upgrades this even further, getting closer to the vegetarian diet by avoiding all animal flesh. An ovo-lacto-vegetarian allows some dairy and egg. And finally, we move to the vegan diet, essentially fruits, vegetables, grains, nuts, seeds, and legumes. The EPIC Oxford study looked at the diets of over 44,000 people. Vegetarians achieve a 32% lower risk of ischemic heart disease, blockages of heart arteries. Vegetarians have a 32% lower risk of heart attacks, stents, and bypass surgeries. Let's move on and look at exercise. A fundamental difference between life and non-life or death is movement. Movement of the organism itself and movement of body fluids within the organism. You're never more alive than when you're exercising. The heart is beating harder, moving vital blood, oxygen, and body fluids to tissues which need it. Exercise is vital to life, and if you're not doing it, you are in a slow process of death and decay. You're dying. Physical activity has been found to preserve brain volume in older adults, and rigorous exercise may delay hip replacement. A study found even a 12-week exercise program in patients with severe hip arthritis reduced the number of artificial hip replacements. The take-home message was, don't be afraid of your pain when you exercise. You won't damage your cartilage. Likewise, exercise works as good as medications for the treatment of depression. The proofs are all in my book. Exercise is extremely important to reduce your dependency on the healthcare system and survive the healthcare crisis. Once again, we're going to talk about gradually upgrading your life. Look how elegant these graphs are, both for men on the left and women on the right. They clearly show that for every year of life, age increasing on the bottom of the graph, Increasing your walking speed, going from red, yellow, and then to green, increases your survival. And it's very easy to tell at every age, the rate of dying decreases as we walk faster and faster. Is there any benefit to upgrading our activity even further? A study by the American Heart Association shows a lower risk of all causes of death as you increase your activity level. This graph shows the risk of dying decreases as you move towards the right and increase exercise intensity. Interestingly, this study also showed the influence of exercise is more important than other risk factors, such as high blood pressure, diabetes, cholesterol, and smoking. Now, if that's the case, if indeed exercise is more important in preventing death than high blood pressure, diabetes, and cholesterol, one would ask why this is not the primary agenda of our healthcare system. At least part of the answer is financial. Drug companies and healthcare systems don't make money when you prevent disease by exercising and eating right. They survive the healthcare crisis only if you take medications and are not surviving. All day long, people walk through my office in misery and despair. Their conditions and suffering are very real. Problems with relationships, depression, and pain. Patients who suffered strokes, heart attacks, and endured bypass surgeries. At least 80% of the issues I deal with on a day-to-day basis all come down to self-control. Ellen White wrote, "One of the most deplorable effects of the original apostasy." The prophet here is talking about the fall in the Garden of Eden. One of the most deplorable aspects of the original apostasy was that people lost the power of self-control. Only as this power is regained can there be real progress. So what do we do to increase our self-control, to eat better and exercise more? Now, we've come a long way to get to this point. First, we saw a very real healthcare crisis developing. You understand the desperate need for mental health, diet, and exercise to prevent chronic pain, heart disease, cancer, stroke, and dementia, arthritis, and diabetes. You've discovered your ability to change. I've shown how a transformational journey sometimes begins as a disorienting dilemma, motivating us to make courageous worldview changes. I've shown how the worldview presented by Jesus promotes mental health and gives us the ability to change. This worldview, as children of God, gives us a new self-image, which the American Heart Association researchers showed is essential to behavior change. To make spirituality easier to understand, to take it out of the hands of the theologians and into the hands of everyday people, I've suggested spirituality is a higher level of thinking, and spiritual disciplines like Bible reading, prayer, and church community are the scaffolding we climb to see better, to get out of mental illness. The trap of chronic pain, and now a physical trap called metabolic syndrome. Like a maze, it's easier to get out if you can get to higher ground and see above the dead ends. Spirituality increases your ability for self-reflection, the ability to transcend ourselves and look back and evaluate our thoughts and actions, including the ability to diet and exercise. Spirituality gives us the ability to constantly survey the landscape of our mind. Now you're at a precipice, a cliff, a point where you can look at your life, evaluate your lifestyle, and see the dead ends and make the appropriate course adjustments needed. There's evidence from several academic disciplines to suggest a positive relationship between an individual's beliefs, values, or attitudes and the decisions and actions we make. So beliefs do bubble out into behavior. Before we can change, we must consider our belief systems and analyze our values. Let's transition to the last part of tonight's program, graceful aging. The first of the baby boomers turned 65 in 2011 and will continue through 2029. During this period, 10,000 Americans turned 65 every day. Already, 1/4 of the population is over 65. What will life be like when the majority of the population is elderly and many handicapped and dependent? The number of Americans needing long-term care is expected to increase from 12 to 27 million. We've looked at the reality of multiple medical conditions. All told, I'm predicting a population of old, indigent, and neglected individuals such as our country has never seen. Staying healthy, functional, and independent, graceful aging requires prevention, which requires a holistic approach, understanding our complete nature, physically, mentally, and spiritually. You know, when we're young, aging seems to occur so slowly, it's easy to neglect the reality of it. Work, family, and other responsibilities are so pressing, we sometimes put off healthy lifestyles. In fact, many destroy their lives just trying to make ends meet. Spirituality helps us work through the demands of life and still maintain your health. The wisest person who ever lived wrote, "Remember your Creator in the days of your youth before the days of trouble come. And the years approach when you say, I find no pleasure in them." We must take time to prepare for the aging process. Indeed, we must take time to remember your Creator in the days of your youth, as only through God's grace can we meet all the requirements of today and still prepare for tomorrow. Thus, I've entitled this part of the lecture, Graceful Aging, rather than Healthy Aging. As aging approaches, habits must turn into lifestyle, and lifestyle must become who you are. What happens when we don't remember our Creator in the days of our youth? What happens when throughout life we've matured fear instead of trust? What does the maturation of fear look like? I certainly don't believe God intends His children to die a slow, painful death when heaven is just around the corner, and yet many people unsure of the afterlife are afraid to die and simply prolong the process, believing this life may be all there is. How sad. I once cared for a man in his late 80s who developed deep ulcers on both legs with no hope of recovery. Having multiple chronic conditions, he was unable to walk or care for himself, requiring 24-hour-a-day attendance. He quit eating, was malnourished, and when given the option, requested a feeding tube. Concerned about the quality of his life, I wanted to make sure he was making an informed consent. You know, it's easy to start a feeding tube, but it's hard to stop it when someone's life is dependent upon it. After educating him, he understood and still wanted the tube. I had never seen anyone struggle so hard for life in the face of death. I asked him about his thoughts concerning life after death, to which he replied, "I never really thought about it." Another elderly man I encountered in the nursing home was miserable despite excellent care. He was very angry and unhappy. I tried to add hope to his life and simply asked if he'd ever thought about heaven. Even on his deathbed, this retired farmer told me he did not believe in God. I asked him where he thought he came from, and he said, "My mom." Two men, both living 80 plus years, one never really thought about God or heaven. The other flippantly ignored any abstract reasoning about life itself. Neither man showing any respect for the mysterious nature of life, let alone their own origin. Is this graceful aging? How sad these same individuals didn't show this tenacity for life when they were younger in the form of healthy lifestyles, disease prevention, and a search for truth. You wouldn't expect someone who'd struggled for decades to live to suddenly give up on life. And yet this tenacity for living sometimes goes beyond a healthy respect for life. Many elderly people pay a terrible price in pain and discomfort just to squeeze out a couple more drops of life. Their fears matured throughout life into a nightmarish situation. Are you going to be an 80-year-old who spent more time trying to understand how your car came into being than you did trying to understand it how you came into being? How embarrassing to live 80 years and at the end say, "I never really thought about it." The truth is, none of us are getting out of here alive. And the thought of death can be so frightening. I've heard people say, I hope I die in my sleep. Yet I've never seen anyone die who wasn't in their sleep. Unless we die suddenly from some traumatic accident or some acute medical problem, we'll all die in our sleep. Whether we succumb to heart disease, cancer, stroke, pneumonia, or some other disease, often the immediate cause of death centers around the effects of dehydration. Regardless of the cause, we eventually become too weak to eat or drink. Now, it's important to understand the person doesn't die of thirst or hunger. We succumb to the effects of dehydration. Now, to mystify and reduce fear, let's look at the experience of dying. Humans can live a month or two without food, but only a week or two without water. Several biological events come together in the natural process of dying. Dehydration reduces kidney function, which increases sodium and potassium in the blood. The sodium actually acts as a natural anesthetic, making the person sleepy, which further reduces their fluid intake. A progressive cycle of dehydration, sodium increases, and lethargy occurs, leading to a state of unconsciousness. But all the while, that blood potassium goes higher and higher and eventually stops the heart, and the person dies in their sleep, naturally and painlessly. This is the hospice concept. And it helps to know that even the dying process is God-directed. Enough said about death and dying. Death is not something to be feared. Most of us will, in fact, die in our sleep. The important thing is to be prepared with advance directives. I have medical durable power of attorneys on the back if someone wants them. But advance directives not only for this life, but also advance directives for the life to come. Let's change directions and talk about healthy aging. I like this graph from the Deerfields Clinic. First, it shows a vertical line toward the left at age 30. At what age do we start to age? Many believe our tissues start to break down and decay about the age 30 or 33. Now, what does that mean? Thankfully, our bodies can recover from a lot of abuse delivered in the teen years and 20s. However, it becomes much harder after the age 30 to recover from all these insults and imbalances imposed on our body. So this graph shows the difference between health span and lifespan. Obviously, if your health span reduces too quickly, as seen in the red curve, you'll become dependent on others and dependent on the healthcare system for the remainder of your lifespan. The important thing is to square off the curve, as shown in that dark blue curve. Staying healthy until just before death. And I'm suggesting staying healthy until just hours before death, or a couple days at the longest. You know, years ago, people didn't live long enough to notice a drop in their health span. Infectious disease caused many to die at a young age, before chronic diseases like diabetes, heart disease, and stroke occurred. Now, interestingly, our improved lifespan resulting from a reduction in infectious disease wasn't due to antibiotics. Our increased lifespan came from immunizations, improved sanitation, and nutrition prevention. Our improved lifespan did not come from the healthcare system. Likewise, our improved health span will not come from a pill. Improved health span comes from improved nutrition and lifestyle. What is needed is not improved health care, but improved self-care. So, what does cause us to age and what can we do about it? Aging is a very complex phenomenon, but research centers around four major pillars of aging: excess insulin, elevated blood sugar, uncontrolled free radicals, and epigenetic changes. Let's briefly examine each one. First, insulin. Numerous studies indicate insulin resistance and related conditions such as metabolic syndrome and diabetes are risk factors for cognitive decline and Alzheimer's disease, and are linked with an increased risk of death from a dementia. Second, blood sugar. Diabetics are familiar with the glycohemoglobin lab, where sugar attaches to oxygen-carrying molecule, which is replaced every 3 months. allowing us to discover the average blood sugar during that 3 months. Importantly, sugar attaches to other proteins throughout the body, accelerating the aging process. Sugar can even attach to brain proteins, which don't renew every 3 months like red blood cells. So these glycated proteins accumulate in the brain, accelerating cognitive aging, suggesting elevated blood sugar can decay brain tissue. Third, free radicals. Oxygen-free radicals cause tissue destruction and age us. They come from numerous things, such as pollution, smoking, and even sunlight. More importantly, for our purposes, oxygen-free radicals come from the breakdown of the foods we eat. Previously, we looked at various diets and the types of food to eat without looking at the total number of calories. But now, as we look at anti-aging, we need to introduce the concept of caloric restriction, reducing the number of calories in our diet. In fact, every animal species ever tested, restricting calories has always produced a longer and more functional life with less chronic disease, in part due to a reduction in free radicals. Caloric restriction slows the aging process, improving memory and mental energy. Fourth cause of aging is genetics or epigenetics. Every cell in your body contains the same chromosomes, our inheritance. But some cells become a heart and some become a brain. Why? Although they all contain the same chromosome material, only certain types of gene information is turned on in certain cells, in various cells. So some cells become a heart and some become a brain. As you know, we have 23 pairs of chromosomes. The top left of the picture is just one of the 46 chromosomes. As you can see, a chromosome, when unraveled, simply contains a single strand of DNA, about 3 meters long, which codes for our entire genetic makeup. For instance, the color of our eyes. There are about 25,000 genes located on these 23 pairs of chromosomes we inherit from both parents, determining our unique physical characteristics. This DNA, importantly, is carefully wound around these blue protein spools called histones, much like spools of thread. This is so amazing. Why doesn't this thread get tangled? Genetics proves the existence of a creator more than any other scientific exploration. For years, scientists thought these genes were frozen and unchangeable. However, we've learned to influence how active certain genes are. Scientists now understand these histone spools also act as switches that can turn certain genes on and off. Certain epigenetic factors, such as diet and exercise, can influence the histone tails, opening or closing genes for aging. Epigenetics can influence important health endpoints. As you can see up at the top right. Important health points: promoting or reducing cancer, autoimmune diseases like lupus and rheumatoid, but also mental illness and even diabetes. Before we move to the next slide, I want to highlight this idea that even genes for mental illness can be turned on and off. Are there some thoughts conducive to healthy aging and other thoughts more conducive to death? Yes, there's evidence that how you handle stress, the quality of your thinking, does influence gene expression. You can find that information in my book. Once again, we see a vicious cycle, this time leading to healthy versus unhealthy aging. How we react to stress affects your brain's ability to react to stress. And all this is influenced by our genetic abilities, epigenetics. The individual is caught in a vicious circle. Thoughts are very powerful. I've shown how your thinking software can change the hardware of your brain. I've shown how thoughts can modify your experience of pain. Now I've shown the things you think about can influence the genetically determined aging process. Thoughts can accelerate or slow aging. Just as it did in mental health and pain tolerance, this begs the question, what are the best things to think about? Which has the best effect on our epigenetically determined aging process. You know, the Bible speaks of generational curses, Ancient man did not understand epigenetics. However, they could see certain less functional characteristics passed down from generation to generation. Now, whether you want to call that a generational curse or epigenetics, the fact is we can have some control over the expression of our genes. If you feel you've been dealt a bad genetic hand, or if it seems like your extended family carries some bad genes, don't worry, there's hope. The information I've shared suggests diet, exercise, the maintenance of life rhythms such as the Sabbath, even correct thinking can turn things around in your life and the lives of your offspring. You can change the genetic hand your family has been dealt. Dr. John Kelly, founding president of the American Lifestyle Medicine, agrees. Our lifestyle choices, for bad or good, are passed down to future generations. Some of us may be victims of the bad lifestyle choices of past generations. Maybe you have a learning problem or a metabolic health problem you consider genetic. I wonder if you want to turn around some of those genes, not only for yourself, but also for your offspring. Dr. Kelly says in the Complete Health Improvement Program, or CHIP, which I would highly recommend, epigenetics is proving we have some responsibility for the integrity of our genome, our genes. He summarizes, changing your diet and lifestyle changes your epigenome switch settings. Changing your switch settings changes your gene expression. Changing your gene expression changes you literally. It all starts with lifestyle. And lifestyle is not just what you do, but who you are. Before we end, I want to say a quick word about my book, Healing the Heart from the Inside Out. As a nation, we spend billions of dollars every year treating heart disease from the outside in. Pills are taken from the outside to change the inside. Catheters probe from the outside to go inside. Scalpels cut through the outside to get to the inside. Pills are expensive, catheters dangerous, and scalpels painful, and yet this seems to be all modern man understands, treating disease from the outside. Listen to this, a heart of stone leads to hardening of the arteries, but a new heart of flesh heals the body, mind, and spirit. Let us conclude by taking a quick journey from the physical to this metaphorical heart. You know, it's easy to see how the physical heart functions. We know the heart is a muscle, and it's clear how it functions as a pump. The kidneys can only be understood on a microscopic level, where you can see the millions of nephrons which filter the blood. However, the function of the brain and mind can only be understood by looking at it, cannot be understood by looking at it, or even visualizing the billions of brain cells with a microscope. The mind and brain is some next level stuff and can only be understood by viewing it from that spiritual level we've been talking about. However, this concept of spirit is empty. It signifies your thinking, but it doesn't tell you about the content or the morality of those higher thoughts. We use the word heart in reference to our emotions, but the metaphorical heart is sometimes used for the moral value of our thinking, the moral and ethical value of our spirit. True, heartfelt transformation requires that we add ethical standards to our lifestyle choices, including food and activity levels. True, heartfelt transformation requires we add ethical standards to our lifestyle choices, including food and activity levels. My book is available on Amazon. However, you need to make sure that you're in the book section and type in the entire title and my name, Healing the Heart from the Inside Out, Roy Small. If you have trouble securing the book or have any questions or comments about the book or today's program, simply email me at jeepdad4949@gmail.com. jeepdad4949@gmail.com. This concludes Moving from Healthcare to Self-Care. My purpose for presenting this tonight is to get this book in your hand. It contains almost all the material we've addressed tonight and more. Take the book home, read it, study it, and share it. Blessings, peace, good night, and be safe. Thank you.